Good morning, everyone. Today we will delve into Chapter 11, Mental State Assessment Part 2. I am your presenter, Tan Yukin. This chapter will provide an in-depth examination of three core cognitive function assessments: memory ability assessment, comprehension ability assessment, and expressive ability assessment. We begin with the first component, memory ability assessment. Memory refers to the impressions of past events retained in the human brain, including short-term memory, recent memory, and long-term memory. Short-term memory, the memory of things that have just happened in the last few seconds or minute. Recent memory, memory of things that happened 1 minute to several days ago. Long-term memory, memory of things from several days ago to several years ago. Assessment content. The assessment evaluates the subject's ability to accurately recall past events, as well as the degree of memory disorder or the completeness of the recall. Methods for assessing memory ability primarily include testing and interviews. The memory ability scoring criteria range from 4 complete memory retention to 0 severely impaired memory. When conducting memory ability assessments, assessors commonly use the following polite phrases. Grandpa/grandma, I'll say 3 things. After I say them, please repeat them and remember them. I'll ask you again in a few minutes. These 3 things are: do you remember what you ate for your last meal? Can you tell me about something that impressed you? Detailed grading criteria. 1. 4 points. The assessment subject maintains a memory ability appropriate to society and age, and can recall past events completely. The main manifestations include: the assessor says 3 words, and after 5 minutes the assessee can correctly and completely repeat the 3 words. Be able to accurately answer what you ate for your last meal. Be able to fully narrate things that have impressed you. 2. 3 points. The subject of the assessment shows mild memory disorder or cannot recall things that have just happened. Key performance indicators include: when the assessor says 3 words, the subject remembers only 0 to 1 of them after 5 minutes. Being able to correctly state what they ate for their last meal. And being able to fully narrate something that impressed them. 3. 2 points. The subject of the assessment has moderate memory disorder or cannot recall recent events. The main symptoms include: not remembering what you ate for your last meal, not remembering recent events that left a deep impression on you. 4. 1 point. The subject of the assessment has severe memory disorder or cannot recall distant events. The main manifestations include: inability to fully recount events that impressed them several years ago, and not remembering their old friends. 0 points. The subject's memory is completely disordered, or the subject is completely unable to recall past events correctly. For example, when the subject recounts something that impressed them, all of their statements are incorrect or fabricated. Assessment considerations. 1. The assessor should inquire in detail about the subject's memory ability in the past week. If the caregiver's account differs from the subject's performance on the day of assessment, the assessment of the subject's memory ability should be based on the performance of the person with the poorer memory ability. 2. During the assessment, the 3 words should correspond to 3 different types of items, and the 3 words should only be said once. Whether the order of the words is correct or not is not included in the assessment of memory ability. We now proceed to the second evaluative component, comprehension assessment. It refers to the ability to understand both linguistic and non-linguistic information. Assessment content. Assessing whether the individual can understand others' speech normally, whether they have comprehension difficulties, whether they need help from others, and the extent of such help. The main methods for assessing comprehension ability are observation and interviews. This is the scoring criteria for comprehension ability. When conducting comprehension assessments, assessors commonly use the following polite phrases. Grandpa, Grandma, how many people are in your family? Are you a local? What do you usually like to do? Grading criteria 1, 4 points. The subject of the assessment can understand what others say within a normal time. 2, 3 points. The person being assessed can understand what others are saying, but it takes them a long time. The person being evaluated needs to spend a considerable amount of time thinking in order to correctly understand what the evaluator is saying. Or the evaluator needs to slow down their speech for the person being evaluated to correctly understand what the evaluator is saying. 3, 2 points. The subject of the assessment has difficulty understanding what others say and needs to frequently repeat or simplify oral expressions. For example, when the evaluator communicates with the person being evaluated, the person being evaluated frequently uses the same words or phrases repeatedly, or frequently uses simplified words or phrases such as yes, no, go, or eat. 4, 1 point. The person being assessed has great difficulty understanding what others say and needs a lot of help from others. When evaluators communicate with the evaluation subjects, they need to explain or break down the content so that the evaluation subjects can correctly understand its meaning. 0 points. Even with the help of others, the person being evaluated is completely unable to understand what others are saying. For example, the assessment subjects are patients with severe Alzheimer's disease who lack the ability to understand information. Assessment considerations. When conducting the assessment, the assessors should pay attention to the accent problem and try to communicate with the assessee using the local dialect. Even when communicating in Mandarin, they should slow down their speech and pronounce words clearly to ensure that the assessee is not affected by the accent problem. 2. Throughout the communication process with the person being assessed, the assessor can carefully observe the person's comprehension ability. Some people being assessed are sensitive to familiar voices, so if necessary, the person being assessed can communicate directly with the caregiver while the assessor observes from the side to make an accurate judgment. Special circumstances. When conducting a comprehension assessment, if any of the following situations occur, they should be recorded in detail in the special items record form. 1. The subject of the assessment suffers from sensory aphasia. The patient has normal hearing but cannot understand the speech of others or their own, and cannot respond correctly to questions or instructions from others. When loud words are spoken in their ear, although their body will react, they cannot give a correct response. In this case, the assessor should assess the subject's comprehension ability as 0 points and record the situation in detail in the special matters record sheet. 2. The person being assessed is in a drowsy or comatose state and does not have the ability to understand information. In this case, the assessor may assign the person being assessed a score of 0 for comprehension and record the situation in detail in the special matter record sheet. We now examine the final evaluative component, expressive ability assessment. Expressive ability refers to the ability to express thoughts and feelings, including verbal and nonverbal expression. Assessment content. The assessment evaluates the individual's ability to express their thoughts or needs normally, whether they have difficulty expressing themselves, and whether they require assistance from others. The main methods for assessing expressive ability are observation and interviews. Scoring criteria for expressive ability. During the assessment, commonly used polite expressions include: when assessing communication skills, evaluators often use the following polite phrases. Grandpa, Grandma, what difficulties have you encountered in your daily life? In what situations do you need help from others? How did he or she help you? Detailed scoring criteria. 1-4 points. The assessed person can express their thoughts normally. For example, the assessed person can express their dietary needs to the caregiver normally or express their opinions on other aspects of life. 2-3 points. The person being assessed can express their needs, but it takes a long time. For example, when the person being assessed seeks help from caregivers, it takes a long time to organize their thoughts and express their needs clearly. 2 points. The person being assessed has some difficulty expressing their needs and needs to repeat themselves frequently or simplify their verbal expression. For example, the person being assessed usually only expresses specific words and phrases, such as hungry, painful, and walk. 1 point. The person being assessed has serious difficulty expressing their needs and requires a lot of assistance from others. For example, the person being assessed has unclear pronunciation and can only say a few simple words, requiring others to keep guessing and asking repeatedly. 0 points. The person being assessed is completely unable to express their needs. For example, the person being assessed is a patient with severe Alzheimer's disease who is unable to express their needs. Assessment considerations for expressive ability assessment. When assessing the expressive abilities of the elderly, assessors should try to communicate with them in the local dialect and pay attention to their accents. For specific details, please refer to the precautions for assessing the comprehension abilities of the elderly. 1. The subject of assessment suffers from motor aphasia. The patient can understand language but cannot express it normally. The core feature is the loss of speaking ability. When communicating with others, although he can understand what the other person means, he can only respond with a few words and often uses inappropriate words. The assessor can evaluate the subject's expressive ability as 2 points and record this situation in detail in the special matters record sheet. 2. The person being assessed is in a drowsy or comatose state and is unable to express information. In this case, the assessor may assign the person being assessed a score of 0 for their ability to express themselves and record this situation in detail in the special matters record sheet. An overview question is provided for post-session completion, requiring integrated application of all assessment principles covered in this chapter. This concludes our comprehensive coverage of cognitive assessment within mental status assessment. Thank you for your attentive participation. This section is now complete.